Hi, this is a PowerPoint for lab number 8, Sterile Asepsis, Gloving, and Dressings. We're going to be moving from the clean, which is medical asepsis, to the sterile surgical asepsis, and there's different principles that goes with this. So we're moving from what you've learned so far in the lab to some new techniques. Sterile means the absence of microorganisms, or that there's absolutely nothing living on that item. Inanimate objects can be sterilized, but skin cannot. Humans will always have microorganisms that live in and on their bodies. So just to be aware of that. Sterile asepsis requires the creation of a sterile field with sterile equipment. And for you, this is what we'll be doing in lab. And so you'll need to understand what that field is, how you maintain that field, and what type of equipment that you use. You're the one that does this. You're creating it, you're doing it, you're in charge of it. And it's important to know all the principles that go along with it. So, examples of procedures requiring sterile asepsis. Some require a full surgical garb. We're not going to be going over that, but that's when you have the hat, the footies, the face mask, the gowns, the special gowns, all that stuff. And it's much more than we're going to go into in the lab. Others of procedures don't require the complete surgical garb, but we do use sterile techniques. So a full surgery, some diagnostic procedures do require full surgical attire. Others, we can do it with sterile gloves and a sterile field. Injections, which you have been giving, we use the alcohol from the center out. We don't use sterile gloves, but we clean the best we can, and we use the alcohol and 2x2s, that sort of thing. Wound dressings, there's several types. We're going to be doing a sterile wound dressing in the lab. A lot of dressings are not considered sterile anymore, but for our purposes, we will be doing a sterile dressing in the lab. Urinary Foley catheters, insertion, trach care, and all that are procedures that you will be doing and require sterile technique. First off, you need to verify that the materials that you'll be working with are sterile. And you need to do that by looking at your expiration date, checking the surgical wrap, making sure it's secure, no holes, no rips. Any damaged packages, can't use them, period, end of discussion. Sterility is violated when an unsterile object contacts with a sterile object. It seems awfully simple, but that's like the basic premise of maintaining sterility. You also want to check for dryness, as you know, because wicking also wicks microorganisms. So here I've got in the lower right hand side of the slide a sterile field, and I've put a red border around here, and that represents a 1-inch border. When you use a sterile field, the 1 inch on all 4 sides is not sterile. It's considered not sterile. You use that when you set the drape out and that sort of thing. So when you drop and you put objects on the sterile field, they must be within that border. If they fall on that border, they are no longer sterile and they must be removed. So something that's a basic premise of what we're going to be doing. Working with a sterile field, you don't want to be talking, coughing, sneezing. That's like pretty much obvious. But you also don't want to reach over the sterile field. It's always better if you reach around the sterile field. How we're setting up, we're not going to be wearing sterile gowns and having a sterile environment. So we are going to keep it just as clean and sterile as we can. Sterile objects can be contaminated by prolonged exposure to air, so if you're going to use it, get it out, use it, don't leave things sitting out. And remember, these are important principles to remember. Anything below the waist is considered contaminated. So if you have sterile gloves on and you put your hands below your waist, it's contaminated. Don't turn your back on a sterile field. You may not have touched anything, but you cannot 100% verify that something didn't happen to that sterile field. Also, if you have a sterile gown on, only the front part is considered sterile, not the back. Okay, so I already talked about the edge of the sterile field. You can actually move it, and in this case, you're probably going to adjust it. You don't really, when you set a sterile field up, it's pretty much going to be where you put it. But you can grasp it underneath with clean gloves to move it, or you can grasp it from the top with the sterile gloves on. And then you can move things about the sterile field with your sterile gloves. Let's see. A wet field is not sterile if there's strike through from underneath. And underneath, I mean an unsterile surface. Say, for example, use a side table, you put a drape down, and there's some liquid on the table that seeps through. You are no longer sterile. Many drapes these days have a plastic base to them, so it won't come through, nor will it come through from the top. But you need to be aware of that. Sterile gloves we wear for procedures not requiring full sterile garb. Once you put your gloves on, you can only touch sterile items. Another very simple thing, but very important. And it's very important to understand the principles of sterility when you're donning the gloves themselves. There's a particular way to do it. You've already seen this hopefully in your Mosby's videos, and you'll be practicing that in the lab. You will be doing a sterile dressing, and there's two things that I want you to remember is that if you're doing a clean linear wound, whether it's a horizontal or longitudinal, you're going to be cleaning from one side to the other in one direction. So we might, if we have a horizontal wound, you'll clean one side of the wound, the other side down the center, but you're always going in the right direction. You always, and if you're cleaning something, you use like a gauze, a wet gauze, and there's one swipe and you throw it away. Another one swipe and throw it away. That's the cleanest technique that we can use. And again, if you have a puncture, such as a central line or something like that, it's exact same as you do for a IM injection or SC injection. You start in the middle and you work out and you clean out, okay? Documentation sample, I'll let you read this over on your own. It is in your book and you will be documenting afterwards. This will be your first attempt at a real documentation in the lab, so it'll be a good exercise for you. And remember, pause, look, listen. Is it sterile or not? And if you use this question, is it sterile? There is no question. It is not. You need to know and be absolutely sure. You must identify any breaks in technique, and remember, because if you break technique and you don't know it, there could be dire consequences for the patient. So this is really important. I've got some pictures here on this slide. I'll let you look at them and figure out what is happening that isn't correct, what has happened. So you can certainly talk amongst yourselves or ask me about it, but I'm hoping that you can identify those issues, and when you watch each other in the lab, hopefully you can identify breaks too, and it will happen. Sterility takes time. It's not something you can work through quickly. It takes being conscientious, alert, and you need to be honest. You know, humans make mistakes, so that's why we work as a team. So don't think it's like, oh, but we do have to have precision in this type of work. So also, beginning student nurse tips is always bring a little bit extra supply with you. You cannot leave a room to get other supplies. You might be able to get someone to come in, but once you turn your back on that field, it's no good anymore. So it's always good to have a little something with you. So as far as the lab's concerned, we're going to be doing the practice of sterile gloving first. You'll be setting up the field. You'll be doing pouring some solution and actually changing the dressing. So we have a lot of information, a lot that'll be going on, and then you'll be doing your documentation. So come prepared, bring your textbooks with you, and hopefully keep calm and stay sterile. Thank you very much.